My name is Burhan Shadhar, and I am from Kasnaini, Cairo University Medical School. And for today, I want to share with you our topic, abstract topic, as regard understanding the effect of neoadjuvant chemotherapy on liver regenerations in hepatoblastoma patients, a case series. I have to say to you that I'm not working alone, of course. The authors is me and my colleague Nadir, and our supervisor is Dr. Hepatoblastoma. And now let's begin. Um, Actually, hepatoblastoma has a very high rate in Egypt, so it makes us come into the big interest to find out more about it. And moreover, the chemotherapy is the one of the main line treatment to cure the hepatoblastoma along with the liver resections. And it has been proved that chemotherapy combined with the other mode is it will have a good outcomes, but unfortunately there's no suffice reference that state that chemotherapy is safe for um, liver regenerations because of the lack of the reference. Now, we want to emphasize, is that really true that chemotherapy will interfere the liver regenerations in this case? So for the cases we had 5 patients, which consists with the 4 female and 1 males that taken from 2018 till 2022 and collected retrospectively. And these patients performed CT preoperatively and MDCT intraoperatively and 3 months for follow-up. And for the chemotherapy, they receive 2 into 4 cycles per patient. And now, how about the results? The results is actually very good. And all the patients give the satisfactory result. We can see here the pictures of the pre-operatively as compared as the post-operatively after 3 months. You can see here there's a development of the liver volume, and of course it indicates the liver regeneration as well. And we are already counted the mean of the rate of the regenerations. It counted about 87% of the liver regenerations, which is good. By the way, the patients may have like 40% of regenerations and 60% of the regenerations. But also, even there's a patient who got the 100% of his liver has been regenerated, and it is good. Although that the lack of the reference that we had to prove that it really safe for each patient as regard the liver regenerations is still questionable. It's because of the lack of the reference. However, there's no proof as well that the chemotherapy will interfere the rate of the liver regenerations. But there is one literature that states that it may affect the appearance of the liver surface and its morphological. But still, we have to prove itself, and to prove it, we have to conduct more and more study to prove is that really safe for chemotherapy. So for the conclusions, we are really highly recommend the chemotherapy as the main line of the treatment. But of course, we care for observations of the liver regeneration and the functions through the CT and MDCT. And also, more study must be conducted to emphasize the effect of chemotherapy on liver regeneration precisely. I'm really glad for all of you scan this barcode to access to our full reference, so you can see by yourself um, the reference that we use in this study. Thank you so much for your attention, and